Some people hear the words bone on bone and instantly feel like their future just collapsed. Because in that moment, many people assume there's only one option left: surgery. And listen, sometimes surgery is absolutely necessary. I want to be very clear about that. There are situations where knee replacement can be life-changing for the right person. But what concerns me is how many people hear the words bone on bone and immediately believe that they have no other options worth exploring. And that's simply not always true. One of the biggest misunderstandings about knee pain is believing the x-ray tells the whole story. But pain is often more complex than that, because I've seen people with terrible x-rays who function surprisingly well. And I've seen people with mild imaging who are miserable. Why? Because pain involves more than just the structure. Inflammation matters, movement matters, strength matters, stability matters, blood flow matters, compensation matters, the environment inside the knee joint, that matters. And when people don't understand that, they often feel trapped. I can't tell you how many people walk through our doors feeling defeated because they already started to grieve their future. No more hiking, no more travel, no more playing with the grandkids, no more walking without fear. And honestly, that emotional weight is heavy, especially when people feel like their body is betraying them. But here's something important to understand. Bone on bone doesn't automatically mean there's zero hope for improvement in your quality of life. And that matters a lot. Because many people can still improve their mobility, their strength, their stability, their comfort and function. I've seen it. And they can do all of this without immediately jumping into surgery. And sometimes when inflammation decreases, function improves. People realize they're capable of more than what they thought. One of the things that we focus heavily on in our Renew Healing framework is helping to support the overall environment of the joint, because joints are living tissue. They respond to movement, circulation, mechanical issues, muscle support, and inflammation. That's why simply looking at an x-ray without looking at the whole person can sometimes create an incomplete picture. And again, I'm not anti-surgery. I want to make that crystal clear. But I do believe that people deserve to understand all of their options. Because once surgery is done, there's no undo button. And for some people, they later realize the real issue wasn't just the joint itself. Sometimes weakness, sometimes it was instability or poor mechanics or chronic inflammation or reduced activity. Those were some of the major contributors. And if those things are never addressed, people can still struggle even after surgery. That's the part that many people never hear. At the end of the day, my goal is not to scare people away from surgery, it's to help people make informed decisions about their body. Because fear-based decisions are oftentimes not the best decisions. Education matters, understanding matters, second opinions matter, and hope matters too. Because too many people feel hopeless the moment they hear the words bone on bone. And I simply don't believe that people should lose hope that quickly.